Hi team, good evening all.
Good evening.
It's very good evening.
Good evening, madam.
Good evening.
Good evening, ma'am.
Good evening. Okay, so I hope all are connected. So we'll start the session. Yesterday we have started with digestive system related pathologies. Any doubts in that team? Is the
No,
session
we're
clear?
good.
Okay. Okay. So shall we proceed with next system?
Yes.
Okay. So next, let's talk about cardiovascular system. So the cardiovascular system, cardio means heart, vascular means a blood supply. So the heart and great vessels. This.
Menaka, now you can try. We enable that, so just you can try.
Yes, sir. Yes, sir. It's enabled, sir.
Okay, fine. You
Thank
can
you.
continue.
Thank you, sir. Okay, sir. Thank you. So we are going to discuss this cardiovascular system, which deals with heart and the blood vessels. It is arteries, veins, and capillaries, which helps in circulation of blood throughout the body. So, like all this blood supply, that is the oxygen supply, nutrients, all these are required for metabolism. Metabolism means nothing but energy production process, which will continuously takes place in our body cells. So this we have studied in our lower classes as tricarboxylic acid cycle or Krebs cycle, where the oxygen and the glucose molecule will be used, and there will be a cycle where so many enzymes will be used, water molecule will be used, and at the end we will get ATP molecules. Energy will be released in the form of ATPs, and carbon dioxide and waste products will be released. Can you guys able to remember that?
Yes, ma'am.
No,
Hmm.
ma'am.
No, okay. So if you're not able to remember, that's not an issue. Like, hope you have, we have studied, right? Like, mitochondria is the powerhouse of the cell where the ATPs will be generated. At least that you know, right?
Yes, yes, ma'am.
Ah. So, for
Yes.
this energy production process to have, I have not started sharing my screen, Pavan. Please wait, I'm just explaining this metabolism. Once I have started sharing my screen, I'll inform you, team. Okay, so getting back to this, each and every body cell undergoes this metabolism process. So metabolism, it requires oxygen and the nutrients, that is glucose. So the glucose we will get with the help of the food which we are consuming, and the oxygen we will get through our lungs. So the blood will carry the oxygen and nutrients. Hemoglobin in the blood will carry the oxygen, and the nutrients will be carried through the plasma part. That is blood, we are having blood plasma, right? That will carry the glucose. And this oxygen and glucose will reach the body cells, each and every body cell, muscle cell, brain cell, kidney cell, heart, lung, liver cell. So all the cells. So what these cells will do is they will take up this oxygen and glucose and they will do a process to release energy. So this energy is responsible for our various body activities. Even to listen my class, you guys need energy. Even to take class, I need energy. So our brain works with the help of the energy. So each and every body function, each and every fraction of second, we need energy to survive, which is generated by all our body cells. So once from birth throughout the lifetime, all these cells are performing without any rest. So during this, energy will be released, and apart from energy, carbon dioxide and waste products will be generated. Nitrogenous waste will be generated and carbon dioxide will be generated. So again, the blood will take the carbon dioxide from the blood, that is the hemoglobin will give oxygen to the cells, and in return it will take the carbon dioxide from the cells and it will move into circulation and it will take to the lungs for oxygenation. So where the gaseous exchange will take place. And the nitrogenous waste which is generated will be converted to ammonia in the liver. And from liver, the waste products will enter the kidneys. Kidneys will filter the waste products which is eliminated as urine. So this is what happens. In a brief note, if we see means this is what each and every body system is doing. So your digestive system is supplying the glucose required for metabolism. The respiratory system is providing oxygen and exchanging carbon dioxide. And our heart helps in pumping blood throughout the body so that the oxygen and glucose will reach the cells. And the blood helps in taking these nutrients and the gases to the required body cells. And along with that, the antibodies is responsible for giving immunity, which again comes under blood and lymphatic system. Then our excretory system, urinary system helps in excreting the waste products from our body. Then what else? Yes, our nervous system is there. So all these activities, whichever I have said, the digestion, respiration, circulation, all these are controlled by our brain and the spinal cord and the nerves. So the brain is our master organ, which is controlling all our organ systems. And apart from that, to regulate this metabolism, whether to speed up the metabolism, to slow down the metabolism, all these are carried out by the hormones. Hormones is produced by endocrine glands, which we are having, that is the thyroid, pituitary, adrenal glands. So these glands helps in producing chemical substances, hormone, which helps in regulating our body function. And if you talk about the musculoskeletal system, so the musculoskeletal system helps in body movement to do various activities. And further, the skeletal system protects our visceral organs. So the internal organs, say for example, our lung and heart is protected by the rib cage. Our spinal cord is protected by the vertebra. Our brain is protected by the skull. So the skeletal system helps in protecting our visceral organs. Further, it gives structure to our body, and it helps in the muscular system together with skeletal system helps in body movement. Then what else? Skin we are having. So skin helps in sensation when someone touches you. When you touch a hot pot, when you can feel chillness, cold, heat, touch. So all these sensations we are getting with the help of our skin. Skin is the largest sensory organ. Then it helps in maintaining our body temperature. So when our body is so much heated up, sweat will be generated to cool down the body. Whereas already if you are in a very cool environment means you will not produce any sweat because we need to maintain that body temperature. And apart from that, we are having other sense organs such as ears, nose, eyes. All this helps in sensory perception. So this is the brief outline of our body. So is this clear? A basic outline.
Yes.
Ma'am,
Yes.
if you're showing for any images, I cannot see for any images
I
or
have
document.
not showing any images, but just I have explained.
Okay, thank you, ma'am.
Okay. Frankly to say, being a physician, I love explaining this body systems. That's why I have just explained a basics I have given you. That's all. If you go in depth, we are having a lot of things in that. But at least you should know the basics to do coding. Okay. So yesterday we have completed with the digestive system. Okay, let's complete the respiratory and move on to cardiovascular. So coming to respiratory system, so organs of the respiratory system, we inhale air through our nostrils. and it will enter the nasal cavity, then again the pharynx, then is the trachea. Pharynx, larynx, then larynx means vocal cord, it contains vocal cords, so we call it as voice box. Then from the larynx is the trachea, which is windpipe. The distal end of the trachea divides into bronchus, primary bronchus, and then the secondary bronchus. This is tertiary bronchus, and these small bronchus are known as bronchioles. And the bronchioles will have alveolus. Alveolus are nothing but air sacs. These will be filled with air. It will always contain air. So here only the gaseous exchange will take place between the alveolus and the pulmonary capillary. Capillary is the connecting unit between artery and vein. So here only the gaseous exchange will take place. That is, oxygen will enter the blood and carbon dioxide from the blood enter the alveolus. So this is known as external respiration. It takes place in our lungs. So once the blood got oxygenated, it will move to our body and the body cells will take up the oxygen and give carbon dioxide, right? This is known as internal respiration, which takes place at cellular level. Okay, team, let's move on to the pathological condition. Epistaxis. So epistaxis means nothing but nose bleeding. Next, asthma. So asthma means narrowing of the bronchi leading to airway obstruction. So the bronchus will be narrowed. As a result, breathing will become difficult. Next,
Madam, not showing full screen, madam.
Full screen only I'm displaying, team. Can you able to see my screen, this asthma?
Yes, ma'am. It is okay, ma'am.
There may be some network issues from your end part, right? Disconnecting and reconnecting. If there is network issue, na, the screen will stay like this. Or else just try zooming out. Maybe you are in Zoom because I'm sharing my entire screen.
Okay, madam. Thank you.
Yes, ma'am. It is proper, ma'am, from my side.
What, pa?
It is proper, ma'am, from my side. Showing
It is
proper.
proper, right?
Yes, yes.
So coming to asthma. Asthma means narrowing of the airway. So as a result, patient will have difficulty in breathing. Next, bronchogenic carcinoma. Carcinoma means cancerous tumor. So cancerous tumor arising from the bronchus is known as bronchogenic carcinoma. Next, chronic bronchitis. Chronic means over a period of time. Bronchitis means inflammation of the bronchus. So there will be inflammation of the bronchus over a period of time. For so many years, this will present. Next, atelectasis. Ectasis means dilation. The meaning for word atelo means incomplete. So atelectasis means incomplete dilation of alveoli. So the alveolus will be collapsed and functionless. It will not be able to hold air in it. As a result, lung capacity will be reduced. So if half of the alveolus is not functioning now, then the lung capacity will be reduced. Next, emphysema. So emphysema means destruction of alveolar wall. Let me show you. This is a normal alveolus, and each alveolus will have air inside it. In emphysema, the alveolar wall will be destroyed. As a result, gaseous exchange cannot take place. This is known as emphysema, destruction of alveolar wall. Pneumonia. Pneumonia is nothing but lung infection. Acute infection and inflammation of the alveolus, where the alveolus will be filled with pus or infectious fluid. So again, as a result of pneumonia, oxygen carrying capacity of the lung will be reduced. So pneumonia needs to be treated with antibiotics. The only treatment option is antibiotics because pneumonia is nothing but lung infection. Next, pulmonary edema, fluid accumulation in air sacs and bronchioles. Patient will get pulmonary edema if they are suffering from heart failure. Those who are having heart failure are prone to get this pulmonary edema. Next, pulmonary embolism means blocking of pulmonary artery with blood clot, with moving blood clot. Let me show you. This is pulmonary edema, fluid built up in the alveoli. So if there is fluid built up now, then there is no space for the air. This is what pulmonary edema is. So pulmonary edema will look like this, white foggy appearance you can able to see. Next, pulmonary embolism. So embolus means a moving blood clot. You can see here a blood clot has formed in the leg that has moved in circulation. And through circulation, it entered the pulmonary artery. What you are seeing here is pulmonary artery. It entered the branches of the pulmonary artery and it is blocking the lung, causing damage. This is known as pulmonary embolism. Next, pleural effusion. So our lung is protected by a double-walled membrane known as pleura. The space in between this pleura, outer wall and inner wall, is known as pleural space. So this pleural space is filled with a fluid known as pleural fluid. When there is excessive accumulation of pleural fluid, we call it as pleural effusion. This is what pleural effusion is, accumulation of fluid in the pleural space. Then pneumothorax. Pneumothorax means accumulation of air in the pleural cavity. As a result, lung capacity will be reduced. Pneumo means air. So, air will get accumulated here. As a result, this air will compress the lung. So, lung will be collapsed. This is known as pneumothorax. So, yeah, that's all about the respiratory system. Any doubts in this team?
No, ma'am.
No.
Okay. That's good. Okay, let's move on to cardiovascular system. So hope you guys know the basic anatomy. Our heart has two chambers, two atria and two ventricles. And the right side of the heart will always contain deoxygenated blood, while the left side of the heart will always contain oxygenated blood. This is superior vena cava, this is inferior vena cava. These two are the largest veins in our body which carries deoxygenated blood and pour it into the right atrium. From right atrium, the blood will enter the right ventricle through the tricuspid valve. So the function of valve is to prevent backward flow of the backward flow of blood. Next term. So from right atrium, the blood has entered the left ventricle through the tricuspid valve. From the from the right ventricle, when the heart pumps, blood will enter the pulmonary artery. From pulmonary artery, it enters the lungs for oxygenation. Then the blood will get oxygenated and through pulmonary veins, the oxygenated blood will enter the left atrium. From left atrium, the blood will enter the left ventricle through the mitral valve. And once the mitral valve, that is, once the heart again contracts, from the left ventricle, the blood will be pumped through the aorta throughout our body. So this is what happens. Next, coming to the Next, coming to the conduction system of the heart. So the electrical impulse will be generated in the sinoatrial node. We call it as sinoatrial node. From sinoatrial node, the impulses will enter the atrioventricular node. From sinoatrial node, impulses will enter the atrioventricular node. From atrioventricular node, the impulses will reach the bundle of His and the Purkinje fibers. This conduction system, this electrical activity helps in heart function. Coming to the pathological condition. Tim, what is the normal heart rate?
72.
72.
72 beats per minute.
Very good, Tim. Excellent. 72 beats per minute. So the normal range is 60 to 100 because it will not be always 72. Depending on our activities, the heart rate may slightly differ. So 60 to 100 is normal. 72 is ideal. The range 60 to 100 will be considered as normal. If it is below 60, we call it as bradycardia, slow heart rate. Whereas if it is above 100, we call that condition as tachycardia, fast heart rate. So if patient is having tachycardia, fast and irregular heart rate, we call that condition as arrhythmia. Heart should beat in a regular rhythm. Rhythm means first the atrias will contract and relax. Then the ventricles will contract and relax. This rhythm needs to be maintained. If this rhythm changes, we call it as arrhythmia, irregularity in heart rate. So in arrhythmia, we are having two types of arrhythmia. One is flutter and another one is fibrillation. In arrhythmia, there are two types. One is flutter and another one is fibrillation. Flutter is a milder form of arrhythmia. Flutter is a milder form of arrhythmia which can be treated with drugs. Whereas fibrillation is a life-threatening condition. Fibrillation is life-threatening, where the heart rate will be 350 beats or more, whereas in flutter it will be up to only 300. Next, cardiac arrest. Sudden stoppage of heart activity is known as cardiac arrest. The heart will suddenly stop its functioning, which we call it as cardiac arrest. Sudden stoppage of heart activity is known as cardiac arrest. Next, congenital heart disease. Congenital means present from birth. So if a disease is present right from birth, we call it as congenital disease. So under this, coarctation of aorta is a congenital disease where there will be narrowing of the heart. Narrowing of the aorta. Aorta will be narrow. So this is what coarctation of aorta is. Severe congenital narrowing of the aorta. Next, patent ductus arteriosus is nothing but it's an opening between aorta and pulmonary artery which fails to close at birth. So at birth it needs to be closed. Because before birth, the baby is surviving with the help of the mother's oxygen. Through placenta, it will get the mother's oxygen. So baby's lung will not function. So there will be a connection between the aorta and pulmonary artery before birth. But at birth, it needs to be closed. If this fails to close at birth, we call it as patent ductus arteriosus. Next, coming to septal defect. Septum means something but the wall which separates the atria and ventricles, or right and left ventricle and right and left atria. So if there is a hole in the septum, which leads to mixing of oxygenated and deoxygenated fluid. Yes. Next, tetralogy of Fallot. This is also a congenital condition where there will be severe narrowing of the pulmonary artery and there will be a hole in the ventricular septum and the aorta will be shifted to the right side and there will be enlargement of the right ventricle. All these four will be present. Next, coming to congestive heart failure. So heart failure means nothing but the heart is unable to pump sufficient blood. If the heart is unable to pump sufficient blood, we call it as congestive heart failure. Next, coronary artery disease. So coronary artery is the one which supplies our heart with fresh oxygenated blood. If there is a blockage in the coronary artery, we call it as coronary artery disease. If it is left untreated, it can lead to myocardial infarction or heart attack. Next, angina pectoris. Angina means chest pain. Chest pain because of insufficient blood supply to the heart is known as angina pectoris. Insufficient blood flow to the heart muscle will result in chest pain, which we call it as angina pectoris. Next, hypertensive heart disease. So hypertension means nothing but high blood pressure. This high blood pressure can affect the heart and it can result in heart failure. If the high blood pressure is left untreated, means it can definitely affect our heart. Next, patient can get valvular disease, problem with the heart valve. So the valves may become too loose, or it can become very rigid, which we call it as narrow stenosis or prolapse, which result in backward flow of blood. In all these cases, we need to go with either we will try to repair that existing valve or we will replace it with a prosthetic valve. Next, aneurysm. Aneurysm means ballooning and weakening of arterial wall. See, ballooning and weakening of arterial wall is known as aneurysm. This is a normal one, whereas this is aneurysm. So the wall of arteries become weak. Next, varicose veins. Yesterday itself I have explained. Any doubts in this team?
No, ma'am.
Okay, that's good. Next, let's move on to excretory system. Can anyone explain about excretory system? Any one of you? Any one of you?
In excretory system,
Hmm.
mainly
consists of
Excretion of waste material through kidney and some other excretion parts.
Mm.
Removal of metabolic waste
kidneys,
Good.
from the body.
ureters, urinary bladder, and urethra.
Very good.
The
So the
function of
organs
the
include
kidney-
kidneys, ureters, and urinary
Bladder.
bladder. That's great.
and the functional unit of kidney is the nephron,
Very good.
which helps in the filtering of the waste materials and absorbs all the useful materials and excretes the waste materials in the form of urine. And a small gland is present on top of the kidney called adrenal gland. And within the kidney, two parts are present, cortex and medulla.
Very good.
Cortex and medulla, and most common diseases are chronic kidney disease, acute kidney injury.
Very good, ma. Good. Excellent. So what your friend, that is what she shared is, it's a very clear explanation about urinary system team. So two kidneys, ureters, urinary bladder, and urethra. And the gland above kidneys are known as adrenal glands. So coming to the kidney has two parts, adrenal cortex and adrenal medulla. Cortex is outer portion and medulla is inner portion. So coming to the functional unit of kidney, which is nephron. Nephron is nothing but individual kidney cell. So the parts of the nephron include glomerulus, where the filtration process starts. Blood will get filtered in the glomerulus and waste will be removed from the blood. A filtrate will be removed. So this water with waste products will enter the tubular system, where the urine will get concentrated. Water will be reabsorbed. Only the waste will alone get excreted. So our kidney function is measured with the help of this glomerular filtration rate. How fast this glomerulus is filtering blood. Based on that only, we can able to decide the kidney function. Glomerulonephritis. So glomerulonephritis means inflammation of the glomerulus of the kidneys. Next, interstitial nephritis. The connective tissue of the kidney will get inflamed. All these are infectious condition. Next, nephrolithiasis, kidney stone. Next, nephritic syndrome, otherwise known as nephrosis, which is nothing but because of problem with the kidneys will start filtering the protein. Protein will also excreted in urine. Next, polycystic kidney disease. It's a congenital condition where the kidneys will have numerous small cysts. So this is what polycystic kidney disease is. You can able to see lot of cysts will be present in the kidney. Next, renal cell carcinoma is malignant tumor of the kidney, which occurs in young children. Next, renal failure means the kidneys fail to filter the waste from the blood. So kidney failure, we are having acute and chronic kidney failure. Acute means sudden onset of kidney function. And if it is promptly treated, now the kidney function will revert back to normal. But in chronic kidney disease, we will not be able to revert the kidney's function. So once there is damage now, the damage will be forever. Yes, that's all in the urinary system. Any doubts in this team?
No, ma'am, clear.
No, ma'am.
Okay, that's good. Next, coming to blood. Any idea about the components of blood?
RBC,
Blood and blood
WBC,
vessel.
platelets,
Red blood cells, white blood cells, and platelets. Good.
platelets,
And plasma cell.
Plasma.
Plasma.
Plasma. Okay. Red blood cell, white blood cell, platelets, and plasma. Okay, so what is the composition of sorry, what is the function of this RBC, WBC, and platelets?
To supply nutrient to whole body.
RBC contains hemoglobin, madam.
And
RBC contains hemoglobin and it carry oxygen. Hemoglobin can carry oxygen to the body parts, madam. Through the
Very
blood.
good. Okay, so it helps
White
in
blood cells
oxygen.
act as an immune system and
White
destroys the
blood cells.
pathogens.
White blood cells can help in a fight against our any disease, some immunity system to our body.
Acts as an
Okay.
immune system.
Then
Platelets help in formation
Platelets
of
help
clots
in
to stop
clotting
bleeding.
formation of blood while bleeding.
very good. Platelets help in blood clotting. Good.
While bleeding.
Very good. Components of plasma.
Water and serum, ma'am.
Mostly contents of water and
amino
proteins.
acids.
Okay, so plasma contains water, then
Proteins.
very good. Plasma proteins, albumin, globulin, and fibrinogen, and then dissolved substances will be there. Okay, good. Okay, so again the plasma proteins are there in this albumin, globulin, and fibrinogen. So fibrinogen helps in blood clotting. Globulin contains antibodies, which helps in immunity. And this function of albumin is to carry substance. So it helps in transporting the hormones. So these are the functions of plasma protein. And coming to white blood cells, so white blood cells, we are having 5 types of white blood cells, which are broadly grouped into granulocyte and agranulocyte. Granule means nothing but dust-like particles in the cytoplasm of cell. You will say red coffee granules. So granule means dust-like particles. So if this dust-like particles is present in the cytoplasm of cell, we call it as granulocytes. If this dust-like particles are absent, then we call it as agranulocytes. So granulocytes, we are having basophils, neutrophils, and eosinophils. And agranulocytes we are having monocytes and lymphocytes. So this helps in immunity, that's all. So coming to anemia, anemia means deficiency of either erythrocytes, red blood cells, reduced number of red blood cells or reduced hemoglobin content. Under that, we are having different types of anemia. Aplastic anemia. Aplastic anemia means bone marrow will fail to produce the blood cells. Hope you guys know all the blood cells are produced in our bone marrow, red bone marrow, which is present in inside our bones. So if bone marrow fails to produce blood cells, we call it as aplastic anemia. The treatment option for aplastic anemia is only bone marrow transplant. Next, hemolytic anemia, where the red blood cells will be destroyed. Hemolytic. RBCs will be destroyed. It's an autoimmune disease. Next, pernicious anemia means anemia because of vitamin B12 deficiency. So we need to give B12 supplements for the patient. Next, sickle cell anemia. Again, it's a hereditary disease where the red blood cells become sickle shaped. Sickle shape means crescent shaped. So sickle cell anemia. See, this is the normal shape of red blood cells, but in sickle cell anemia, the red blood cells will become sickle shaped. So it will not be able to carry oxygen. Next, thalassemia. Again, it's a hereditary condition which is run in genetics families. Here, hemoglobin will not be produced in the patient's body. Next, polycythemia, increased red blood cells. Poly means many. Next, hemophilia is a bleeding disorder because of a lack of a clotting factor. Next, leukemia is a blood cancer. It's a white blood cell cancer where the white blood cells will be produced in excess. Multiple myeloma, again it's a malignant cancerous tumor of bone marrow. Next, coming to lymphatic system. So lymphatic system is a separate set of organ system where you can see these are known as lymph vessels or lymphatic channels, and through this the lymph fluid will flow, and this round nodules are known as lymph node or lymph gland. This lymph node or gland will contain enormous lymphocytes where this fluid will be filtered for any pathogens. Next, coming to spleen, then thymus, all this comes under adenoid, tonsils and adenoids comes under lymphatic organs, which is nothing but they'll contain lymphatic tissue, which helps in filtering the pathogens. So coming to the pathological conditions, acquired immunodeficiency syndrome. So patient who are exposed to HIV virus will get this AIDS, where the patient's immunity will be completely shattered. Next, hypersensitivity. This is otherwise known as allergic reaction or anaphylaxis, where the body will produce excess reaction to a common substance. So we'll say, right, we are having dust allergy, pollen allergy, dog or cat hair allergy. So this is hypersensitivity. Okay, so that's all about the lymphatic system. Okay. Team, any doubts in the systems which we have covered so far?
No, ma'am.
Okay. Yeah, okay, team, then that's all for today. Tomorrow also we'll have session, team, with the same link. You need to connect by 8:30, okay? Yeah, okay, team, then. Thank you, team. Bye. Good day. Good night, team. Bye.
Thank you, ma'am.
Good night.
Hello, ma'am.
Bye.
Hello. Hello, ma'am.